The pandemic has left a trail of grief, frustration, and panic, with some Canadians dealing with immense loss of family, physical challenges from the virus, and others facing hatred, racist attacks, stereotypes, and discrimination. Being blamed for the virus, COVID-19 has highlighted an ugly truth here in Canada. And among those targeted are doctors and healthcare workers. But as they continue to save lives, they also continue to battle the hate. Joining me on our Realities of Racism panel, Dr. Jennifer Kwan, family physician. Dr. Hassan Masri also joins us, critical care ICU doctor and associate professor of medicine at the University of Saskatchewan. Thank you both so much for sharing your time with me today.
Thank you for having us.
Dr. Masri, let's start with you first. What have you been experiencing over these past, unfortunately, these several months here with regards to racism and discrimination?
Yes, so I think that, the pandemic has brought a lot of really good things, and in terms of in our society, and a lot of people thinking of each other and protecting each other. And there's a lot of good things that came out of the pandemic. But it also, certainly with the fear and the uncertainty, the pandemic has brought a lot of the ugly racism that was always there, and it certainly does not represent the majority, but it does represent a small number that is significant. With fear comes uncertainty, and I got a lot of messages in the beginning of the pandemic that would go either directly privately to me or publicly through social media, saying, "That's great what you're saying, but we would love to have a doctor that's actually from here." And of course, the word "from here" means that you're not from here. And that is simply based on an appearance and maybe a facial hair or a name. And those attacks started to increase more and more as the pandemic started to continue. And oftentimes they took a very malicious and sometimes threatening tone.
Yeah, I know. I know some of the ones that you're talking about, Dr. Masri. Dr. Kwan, talk to me about what you've been experiencing.
Yeah, so despite being in Canada for over 25 years, I definitely do still experience racist comments and discrimination, unfortunately. And it has gotten worse over the pandemic. So even if it's just a common, comments like "go back to where you came from," or when working at the vaccine clinic being told that, "Oh, you look the same as, the other Asian physicians." Sometimes it's more subtle in terms of being treated differently at the bank or at a restaurant. While these aren't really commonplace interactions, as Dr. Masri said, they still do happen, and reminds us that racism does exist still, unfortunately, in many different forms.
And you both, along with so many doctors that we have spoken to here on CTV News Channel, have really put yourself out there. You both have your practices and your work and your careers. But when this pandemic hit, we reached out to you and you said, "Yes, I'm willing to come on the air to speak to Canadians and give them the knowledge and information, important knowledge and information that they need to help them through this pandemic." To get the backlash, and we're not saying that this just started because of the pandemic, because I know both of you have continued to experience it throughout your lives, but to have it highlighted, what has it done for your mental health? Because again, to remind Canadians, this has been a very difficult time for all of us, but as doctors, as healthcare workers, frontline workers, we know that you've been also dealing with a great deal of stress, a great deal of loss, Dr. Kwan.
Yes, unfortunately, we have gotten used to it over this time, but we have, generally taken precautions for safety and privacy. What these people making hateful comments want to do is to silence us and stop that information. And of course, we are not going to stop. It's very important to continue providing useful information for Canadians so that we can make informed choices for our safety during the pandemic. And my concern more is also for the elderly people in our lives. For example, my friend's mom was out grocery shopping and someone tried to lunge at her in broad daylight. So it's not just about these harmful racial slurs, but it's also for physical attacks that can be a safety risk, especially for vulnerable seniors.
Yeah, certainly. Dr. Masri, what about yourself? How's it affected your mental health? I know you're a very positive person, but it can take a toll.
Absolutely. I must recognize the privilege that I have being a male physician. That comes with a lot of privilege, but it's incredible to see that someone who is in my position could still be subjected to these attacks. And it makes me think about my colleagues who are of a minority, my female colleagues, etc., who are obviously more prone to these attacks and to the racism. It makes it very challenging because just like anyone else in society, we rely during the pandemic on the regular support system that our fellow citizens have, our friends, our families, and those support systems were not available during the pandemic, especially in the peaks. We were not able to see our parents or friends, and so to have that. At the end of the day or the beginning of the day before I start my day, I do a lot of work on social media and I prepare for what I'm going to talk about, or at the end of the day, and to see a few attacks in my inbox or, on publicly is quite difficult to go on with your day. But at the end of the day, as Dr. Kwan mentioned, these minority voices or these voices that are trying to silence us actually motivate me to speak louder, to make sure that my message is reach out, so I could represent my colleagues who are working every day to spread the truth and save lives on a daily basis.
And I commend both of you for that perseverance and determination to continue to do that. I know that there is also a lot of support that is out there. People are listening and very much appreciative of all the work that you and your colleagues continue to do throughout this pandemic. So before I let the both of you go, I've got just about a minute or so left. How do we move forward from this? Dr. Masri, how would you say we need to move forward from this and remove the target, if you will?
I think we need to continue to talk about it, to make sure that these problems existed for a very long time. And I myself, just like Dr. Kwan, been here in Canada for over 20 years, and I've seen these things growing up around my parents and my family. However, this was a taboo topic and we didn't talk about it often. We did not make systemic changes to these things. So we really need to continue to talk about it, to address it. Even though it represents a very small minority, it needs to be addressed head on. And that's the only way to move forward. Ignoring our problems or pretending that it does not exist does not solve any problem.
Dr. Kwan, your last thoughts on this?
Well, we are all human and we're all Canadians, and we should strive to love our neighbors, to respect one another in our daily interactions. And regardless of your background, we should be striving for, peace and love with one another. So we do have to continue speaking up in support of people who may be more underprivileged or vulnerable.
Yeah, certainly. And again, I know Canadians are listening right now, and they are in full support of all the hard work that you and your teams have been doing and your colleagues right across this country. It has not been easy, and we always appreciate you giving us your time here on CTV News Channel to try and answer a lot of those very difficult questions. Dr. Hassan Masri, Dr. Jennifer Kwan, thank you again, and the conversation will certainly continue. We always appreciate your time.
Thank you for having me.
You're both very welcome.